Welcome. In this video, we're diving into sarcoidosis, an inflammatory disease that can affect multiple organs, with a particular focus on its impact on the eyes and cranial nerves, including those responsible for hearing. The exact cause of sarcoidosis remains a mystery. It's believed to be triggered by an immune response to an unknown substance, perhaps an infectious agent, chemicals, dust, or an abnormal reaction to the body's own proteins. It's not contagious and doesn't appear to be directly inherited, although genetic factors may play a role in susceptibility. Sarcoidosis is characterized by the formation of granulomas, which are clumps of inflammatory cells. These granulomas can form in any organ, but they most commonly affect the lungs, lymph nodes, eyes, and skin. When sarcoidosis affects the cranial nerves, including the auditory nerve, it can disrupt nerve function, leading to a variety of symptoms. Ocular involvement is particularly concerning, as granulomas can damage various parts of the eye, leading to vision impairment or even blindness. The mechanisms behind granuloma formation and their impact on specific tissues are complex and still under investigation. Sarcoidosis can occur in people of all ages, races, and genders, but it's more common in adults between the ages of 20 and 40. The incidence is higher in people of African descent, particularly in the United States. The prevalence varies geographically, suggesting that environmental factors may play a role. It's important to note that many cases of sarcoidosis are asymptomatic and may only be discovered during routine medical examinations. The signs and symptoms of sarcoidosis are diverse and depend on which organs are affected. When sarcoidosis affects the eyes, symptoms can include blurry vision, eye pain, redness, light sensitivity, and dry eyes. Cranial nerve involvement can manifest as hearing loss, tinnitus, ringing in the ears, facial weakness, or difficulties with balance. Other common symptoms of sarcoidosis include fatigue, shortness of breath, persistent cough, swollen lymph nodes, skin rashes, and joint pain. Sometimes it can cause neurological symptoms such as headaches, seizures, and cognitive dysfunction. Diagnosing sarcoidosis can be challenging, as its symptoms often mimic other conditions. The diagnostic process typically involves a combination of medical history review, physical examination, blood tests, imaging studies, and biopsies. Blood tests can reveal elevated levels of certain enzymes, such as angiotensin-converting enzyme ACE. Chest X-rays or CT scans are often used to detect granulomas in the lungs and the lymph nodes. A biopsy, which involves taking a tissue sample for microscopic examination, is often necessary to confirm the diagnosis and rule out other conditions. An ophthalmological examination with slit lamp is used to diagnose eye-related issues. Auditory tests are crucial to assess cranial nerve damage. Some tests can include auditory brainstimulants (ABR), pure tone audiometry, speech audiometry, and otoacoustic emissions (OA). Sarcoidosis isn't typically classified by type, but rather by the organs involved and the severity of the disease. Staging systems are sometimes used for pulmonary sarcoidosis, based on the extent of lung involvement seen on chest X-rays. There is no cure for sarcoidosis, so treatment focuses on managing symptoms and preventing organ damage. Corticosteroids, such as prednisone, are the mainstay of treatment for many forms of sarcoidosis, as they help suppress the immune system and reduce inflammation. Immunosuppressant medications, such as methotrexate, azathioprine, or infliximab, may be used if corticosteroids are ineffective or cause unacceptable side effects. For eye involvement, eye drops or steroid injections may be used. For neurological symptoms and cranial nerve damage, a multidisciplinary approach involving neurologists, ophthalmologists, and audiologists is essential. Regular monitoring is crucial to assess treatment effectiveness and detect any complications. Pulmonary rehabilitation, physical therapy, and supportive care can help manage symptoms and improve quality of life. Unfortunately, there are no known ways to prevent sarcoidosis since the cause is unknown. Maintaining a healthy lifestyle, avoiding exposure to environmental irritants, and seeking prompt medical attention for any concerning symptoms may be beneficial. The prognosis for sarcoidosis varies widely, depending on the extent and severity of the disease. Many people with sarcoidosis experience spontaneous remission, meaning the disease resolves on its own. However, others may have chronic or progressive disease that requires long-term treatment. Recent research is focused on identifying the underlying causes of sarcoidosis, developing more targeted therapies, and improving diagnostic tools. Studies are exploring the role of genetics, environmental factors, and the immune system in the pathogenesis of sarcoidosis. Clinical trials are also underway to evaluate the efficacy of new medications and treatment strategies. Early diagnosis and appropriate management can significantly improve outcomes and prevent long-term complications.